About health insurance needs for your children in a divorce situation, there are really two things that you need to consider. First of all, who is going to provide the actual coverage? And the second, who is going to pay for that health insurance each month? In the first concept of the provision of the insurance, many things need to be looked at. There is a possibility that you will have 4 insurance options to look at some point in time. Because in the event that you remarry and your new spouses are employed, their insurance is by law, they are able to carry, if they would like, stepchildren on that. So the reason that I bring this up is when making the decision of who should provide the coverage, many courts, many attorneys and judges make mistakes here where they mandate that one specific individual is going to be the provider of that coverage. And that would not necessarily be always the best scenario. If a judge orders dad to be the one that provides the health insurance coverage, and he happens to be self-employed, and then further says that the parties are going to split the insurance premium amount, hypothetically, which we'll talk about in a minute, on the cost, and mom happens to work for a company that pays for 100% insurance. If the parties on their own, just because it's smarter math-wise to have mom provide the insurance, they violated a court order. Now, I don't think that any judges will be throwing anybody in jail for that. However, the better idea is to craft the agreement right in the first place. And that is to say that the parties agree that whomever can get the best coverage at the most affordable rate, and finding that balance, that party will become the insurance provider for that period of time through their employer. Every single year, you review your insurance options, and you can review those options again a year later, and it could be at that point in time, like I said earlier, that there might be 4 insurance plans to choose from. You can even opt to have one of those insurance options be a primary coverage, and another one be a secondary coverage. That can be beneficial for the purpose of eliminating any out-of-pocket expenses. If you go through your agreement, ask the mediator to show you some different language options on how to craft the agreement where it states that you are going to select the best coverage option at that particular time. The next issue is who is going to pay for it. And there's several different ways that can be split. There's so many components of a child support financial agreement that it would be impossible to go over every scenario, but some examples might be that, of course, there's the traditional 50-50 model, which is one that the courts often use. We have found that doesn't always represent the fairest scenario, because the parties, if they have grossly different incomes, their base child support was calculated on that proportionate income amount. So it makes sense that some of these other categories, including the health insurance, could also be calculated and split proportionate to income. It's important to note when making that calculation that the amount of health insurance that we're talking about, the cost, is just the portion that it costs extra for the children to be covered, not the entire premium that's paid for the month, because the entire premium is going to include coverage for yourself or for your spouse. It's the amount that the insurance company adds on to that each month to have your children covered. Now, there are some states, for example, in Oregon, the court's required to use the entire amount of the premium, but the majority of the states are going to go off of just the portion that is added to have the children covered. And if you're having difficulty on figuring out what a fair split would be, make sure that before you make a decision, you've factored in all the additional parts of a good child support or financial support agreement. There's daycare that needs to be factored in. There's extracurricular activities and logistical expenses, and there's also out-of-pocket expenses for medical and dental that you ought to be factoring in as well before you agree completely on who's going to pay that premium.